have found Advancing with Amy, Mental Health Warrior. And I'm Amy. We discuss everything from mental health to neurodiversity and everything in between. Today, we're talking with inspirational author and psychologist Dr. Cindy Hoard. Let's get started. All right. If we could start with you telling me a little bit about yourself and how you got into this business.
All right. I am one of four girls, the oldest of four. And I started out as a special education teacher and did that for 7 years. And then went back and got my doctorate in psychology, the specialization in development and very young children, and have practiced as a psychologist, primarily diagnostically related to principally early autism diagnosis. So that's my professional background. And then the focus of my book, Spirit Rising, is a detailing of my journey with depression. I was diagnosed at 10 years of age, and I have been through lots of different kinds of treatment, including experimental treatment. And along with that, there's been a parallel in my own spiritual journey, and the two have woven together. And I feel like the depression, as challenging as it has also been a great springboard for me in terms of my own spiritual development.
So, can you tell me a little bit more? I'm curious, what kind of experimental treatments have they tried?
The one very experimental treatment has been deep brain stimulation.
Wow.
I had a deep brain stimulator implanted 12 years ago as part of a clinical trial out of Emory University in Atlanta.
Okay.
And I had to go through quite a process to get accepted. In the process of getting to that point, one of the only treatments that I hadn't had prior to that was EC. And so for me to be considered for the study, I had to undergo that. And I underwent 26 sessions of that. Had
Wow.
had no impact. I've been treated with medications, various medication combinations over the years, which in my case has made a difference.
Good.
And fortunately, I've had one practitioner in particular, who got to know me really well and really floated with wherever I was at the moment and knows me well enough to know when something's not working. And we've had to cycle back around sometime along with ongoing therapy. And so I feel really fortunate that I've gotten to do a variety of things, and it's definitely been a challenge at times. I went on disability for a period of about 8 years
Mhm.
because I couldn't function. Went back and lived with my parents. That melded into caring for my parents in the end of their lives, but then continued to make progress. And throughout all of this, I did a lot of journaling, and that then became a tremendous resource for writing my book because it really let me go back and document when various experiences took place, both in terms of life experiences, treatment, and all of that, as well as then the evolution of my spiritual piece.
Wow, that's wonderful. I'm a big advocate of journaling. Do you prefer just open journaling or do you like prompt?
I've done both. I'll get up sometimes in the morning and I'll just start writing where any particular thing comes to mind that I've been thinking about. And I've started a second book, and that book came from waking up early one morning with a working title and potential outline and everything. And this was before I had finished my first book. And
Wow.
that kind of prompted me stepping back from my private practice, my part time private practice, to focus on finishing the first book and hopefully the second. The first book has been like learning a whole new profession. It almost feels like the writing was the easy part. Now dealing with marketing, the ins and the outs, and have a marketing coach who's been very, very supportive, but still trying to get it off the ground. We had a good launch. That was mostly people I knew.
How long have you had your own practice?
I worked for a couple of different agencies. When I came out of graduate school, I worked for a company that primarily has served families with children birth to 5, kids that have special needs, families involved with child protective services, and largely I worked in Head Start programs and
Oh,
worked on
great.
the mental health component of the program, which is listed out there as a solid component, but hasn't had a lot of form and shape to it. And so I was working with people at the higher level
Okay.
in terms of trying to talk about, okay, what does mental health mean? What can we do to address that? What services can we offer? Things tend to be very classroom based. And of course, we needed a stronger family piece when it came to dealing with the mental health things. Different
Wow.
aspects of the program were more likely to deal with that. Their zero
Right.
to three program called Early Head Start. It has a much stronger parent engagement focus than just the regular Head Start program.
You brought up a fascinating question. What is mental health?
The difficult thing to define because we tend to be so focused on the problems as
Mm-hmm.
opposed to really focusing on health and wellness and how do we keep people mentally healthy and
Yes.
not have to start with someone who's in distress and having a very difficult time. I think a lot of it is educating people about what mental health is and that individuals diagnosed with mental illness, there's a lot of stigma out there. I think there can be a lot of judgment about it. Even in my own experience, I had one sister who was just kind of, pardon my French, hell bent that if I would just do A, B, C, D, and E, I'd be okay. And she didn't understand that wasn't meeting me where I was at that point. And I was in survival mode. I was, okay, let me get through the next day and get the basic things done. And in hindsight, she understands that now, but she was
Oh,
very
good.
angry with me at the time because she felt like I wasn't responsive to her and that I didn't care what she thought.
Can you tell me a little more about your book and who it is meant for?
Sure. I avoided using the term memoir a lot initially, but I really was advised over time to use that term because there is memoir woven in. But there's also a lot of education built into it, talking about the various kinds of treatments and approaches to therapy. There are ways in which it has a really broad audience, in fact, a broader audience than I actually even imagined. I think initially I thought it was maybe for people who were looking for ideas about self
Hmm.
care and connecting with services, and family and friends who are trying to understand someone who's going
Right.
through very severe depression from the perspective of the patient and what they're going through. And yet, there's also just a discussion about different types of therapy. For instance, I was originally treated with an approach of cognitive behavioral approach when I was in junior college, which I'm somebody who consumes it. I want to understand it. I want to work it. I want to make it
Right.
happen, which I did. But it planted a seed in me that I should just be able to change my thinking and feel better. And that ended up working against me.
Yeah.
And I actually had psychiatrists at the clinical trial say to me, Cindy, if changing your thoughts could have taken care of your depression, it would have happened a long time ago. And that kind of built in me the stigma around it for me,
Hmm.
realizing that for some people it's really helpful. But it
Yes.
had almost worked against me in that situation. Just to say that you really need to explore the different kinds of options. Also, talking about the importance of when you are seeking therapy, you are the consumer. You are the one who makes the final decision that you need to interview that potential therapist and
Yes.
see if you're on similar page, if you connect in any way. I did extremely well in my work. I didn't until 1 year ago, so over 20 years of practice, have a family my diagnosis. One family in all of those years. There are lots of different variables that calculate into that. But it also can be that maybe they just didn't connect with me for whatever reason. And that hasn't been my experience.
You've brought up a
Um,
lot of interesting things. I want to go back to what you were saying about changing your thoughts.
mhm,
What I noticed for me, and I wondered if it was the same for you, is that once I got my medication correct and the chemistry in my brain was better and I was able to think positively, then I could start to focus on changing the way I was thinking.
sure. And that's why I'm not saying it's not a good approach. What I'm saying is you have to look at that fit. And along with that, then also goes being as informed as you can of what are the options that are out there? Who are the various kinds of people? My best medical treatment in terms of medications came from a psychiatric nurse practitioner. And I interfaced with different psychiatrists at different
Mm-hmm.
times. And I won't say they were all negative experiences, but the thing about my nurse practitioner is that she's more holistic in her thinking. And for me, there's a lot of parallel between that and even the work that I did because we needed to look at children and families holistically and realize all the different factors that are impacting what's going on with that family and how you find someone. There's not an easy step one, two, three about it. There are huge issues around coverage and what if you one, do you have coverage, period? And even if you have coverage, what kind of coverage?
And what
Uh,
are the co-pays like? Can you afford those?
exactly. What is the number of sessions? Most of that's going away now, but there was a period of time where insurance companies would only pay for 20 sessions a year.
Yeah.
So, there are some good community resources out there. I mean, people who are therapists have to get trained and they have to have experience. And if they're in the right clinic with the right supervisors, that can make a huge difference. I have done doctoral supervision over time and you know, there again, you've got a wide variety of approaches to that. I always took my supervision with them and the ones that I received very seriously.
Oh, definitely.
I felt like those were critical to me growing.
So, as someone who has struggled with depression and worked with people who are going through that, what would you recommend to someone like one of our listeners who's struggling right now and they feel like there's no hope? Where do they begin to find that?
Well, I think a good starting place is just looking at your immediate circle of family and friends. And are there people that you trust enough or feel comfortable enough with to talk about where you're at?
Mhm.
And for them to be supportive, whether that could be anything from I'm here for you to what do you want to do? Can I
Right.
support you or help you? And part of the issue at that point then becomes what are you looking for? Are you just looking for somebody who's going to write a prescription? Are you
Right.
looking for somebody who's going to do some ongoing therapy? Are you in a spiritual crisis and do you want to look for someone who could do some spiritual direction with you
Right.
that might help you? So there's lots of different ways to reach out and to try to get help. And there are experiential things. For me, the progression of my meditation and mindfulness practices has been huge
Yeah.
in my overall care and recovery. And even now in my blogs on my website, that's one of the things I talk about a lot is self-care. What are you doing to take care of yourself? And put meditation and mindfulness out there as things number one that don't have to be religious because there's a lot of misconceptions out there. And yet some of the richest things that we have come to understand about mindfulness and meditation have come from other belief systems. And people tend to separate everything out. But the reality is there's commonality. There's that
Yes.
commonality in something greater than yourself.
Can you explain a little bit about meditation and mindfulness, and is there a difference between the 2?
Interesting question. I think for me, the distinction I would make is the thing I most associate with mindfulness is being present in the moment. What's happening around you? What's happening inside of you? A big piece of that is what's happening in your body. Are there places where you're holding emotions or stress or
Mhm.
anxiety or literal physical problems? In the course of all of this, I've been through breast cancer twice. I have
Wow.
had a problem called endometriosis, which put me in the
Mhm.
operating room many times. I now have an ongoing issue with SIBO. You got to look at all of that. So you got
Mhm.
to look at physically what's going on, obviously impacts everything going on in your life.
Oh, definitely.
So the mindfulness is about being present in the moment. And that's probably the thing I bring up the most with people. I have a massage therapist who's absolutely wonderful. She's an integral part of
Yeah.
my treatment, therapy, health,
Mhm.
whatever. And it's a riot because here's this person who is very gifted, and yet she will get so wound up. I mean, I actually gave her a t shirt that says, inhale, exhale. And I say to her, are you breathing?
Yeah.
And she'll look at me and say, oh, yeah, I'm supposed to breathe. And people don't understand that there's an intentionality about breathing that really makes the difference. So here's somebody who's on the one hand, really attuned to overall wellness, and on the other hand, can get totally whacked out with anxiety by her own admission. I am saying, okay, are you breathing? And what I tell people is start out with 3 deep cleansing breaths that you can do anywhere, anytime. And you're in that line where you think, oh my gosh, I'm never going to be able to get checked out. But if you can just engage in some deep breathing and the mindfulness at that moment, that time's going to pass a lot quicker. And so that's why I think that the mindfulness is the real starting point. Then the
Okay.
meditation is, again, a process. I use a combination of things. I've got my own mantras that I
Hmm.
use. The one right now is when I stay present, I am more patient. But those change at different times depending on what's going on. And I use recorded meditations periodically.
I do.
I just have discovered another set of meditations in the past month or two that I just love from an organization called the Mindful Movement. They do a wide range of things. They'll do everything from sleep meditation to anxiety to depression. So there are different themes in those. And I think the benefit of those is having the guided direction, if you will, about what kind of breathing to do, how deep. I mean, there's so many different ways to do breathing. And people don't realize that breathing is something we do all the time and couldn't live without. But it's also something that we can get tuned into and that we can respond to and we can begin to incorporate in our own life.
I find this conversation fascinating. I wonder if you could tell us just briefly about cognitive therapy. A lot of people don't know what that is. Can you explain that and what kind of different therapies there are for people?
Cognitive behavioral therapy. Let me back up one step. Psychology started out as a very scientific oriented field. And what that meant was that you had to have evidence to base anything you did to make it legitimate. And in order to do that, you have to do research, and the research has to show change in some manner. Looking at change in emotions is not a simple thing to do. There are certainly many checklists out there that can be used and have been used in some of the research. But over time, there's been a real expansion of getting into finer things like facial expressions and body language and quality of life. There's been a real expansion, if you will, of the field in terms of tapping into the effectiveness of therapies in different ways. There's all kinds of information out there, a lot
Right.
that could be talked about. But I think the thing is that cognitive behavioral therapy is one of the most concrete ones in that they have focused specifically on language and self-talk. And the way that's effective is in a relationship with a therapist who can, in fact, help you see where your reasoning or your thinking may be off. One of the things I've said about my therapist of over 20 years is that she's what I call a perspective angel, because there are times when I know that my perspective on what's going on is off in a deep end somewhere and not helping me. She knows me well enough that she can raise questions and then I can get back on a more even keel.
Yeah.
She's got to have the skills to know me well enough to be able to see that happening. And I have to have enough trust in her to be able to hear whatever feedback she's giving me and doing something with that. I think one of the things that I do in my book is I do short descriptions of different kind of approaches to therapy, like major schools, for instance, psychodynamic therapy, which many associate with Freud and psychoanalysis. I personally learned about it in graduate school, but I thought, man, I'm not doing that. And yet I have an extremely close friend who I actually dedicated my book to and who just died in November, who went through a very significant life experience and ended up with a psychotherapist who made a huge difference in her life. That approach helped her significant trauma issues to deal with. And of course, out there now, there's so many different approaches to trauma.
Mhm.
There are major different kinds of programs. EMDR is one that
Mhm.
is big in the news these days. You have to be highly trained to do that. I went for sessions of EMDR,
Mhm.
and I think the reason I didn't connect with it was that given where I was at emotionally at the time, I didn't have the readiness for it. If you, I
Yeah.
know a lot of people who practice it and swear by it, and I know people who've undergone EMDR and have been very pleased with the progress.
You do have to be ready and be in the right mindset, and you have to be with someone you're comfortable to be honest with.
I think that those are things that you have to think about no matter what form of therapy you're entering. But if that connection isn't unfolding and happening, then the match may not be right. I'm going to back up to when I was a teacher. I did that for 7 years. And it was interesting
Ah.
because I had kids who were in the 6 to 8 or 10 age group. And the classroom in those times in the 70s was labeled a learning disabled self contained classroom. And at that time, my classroom was a little bit of everything. I had kids with emotional problems. I had kids with learning disabilities. I had a little boy with muscular dystrophy who was wheelchair bound. I had kids that had communication problems. Became the one that the district would send kids. I didn't know what to do with them. It was like, okay, we'll send them
Aw.
to Cindy and she'll figure them out. As an example, I had a little boy who came into me who was just a sweetheart, but he wasn't talking. And he would
Mhm.
mime and he would point and he would do all kinds of things to try and communicate with you. And it turned out that he had extracranial had grown and closed down his ear canal, was not hearing, and that hadn't been identified. I started working with him and I was doing an assessment with him where you show him pictures and then they're supposed to tell you what they saw. He couldn't tell me, but he could mime something for every single picture. He could
Wow.
communicate with me what it was, even though he couldn't talk. And so that was a clue to me then that we needed to figure out how to give him ways to communicate and
Mhm.
to give him time to communicate in whatever way he could. He came along wonderfully and was very successful. All
Amazing.
all to say that it's about, for me, it's about your ability to observe what's going on with the child. Again, back to the connection issue, but then
Mhm.
also to nurture and get the most out of them that you can. So that's where I came from as a teacher. And part of the reason I went in to get my doctorate was because I wanted to be able to help more children and families. I
Right.
felt that with my doctorate, I could do that. So I've focused on children in the birth to 5 to 10 age group,
Mhm.
influenced to some extent by the fact that my mother was a preschool director,
Aw.
very successful, and started 3 or 4 different preschools. In the process of that, became very involved with early intervention. In other words, trying to get kids with disabilities or special needs diagnosed from the time they're as young as possible. With the early intervention programs, a child can go into early intervention program at a couple of months of age.
Mhm.
Of course, the earlier we get these kids started, the better it is for everybody. They're
Definitely.
much more likely to make progress. Families begin to have the tools they need to be successful with their child and nurture their
Yes.
child, and they can gain external supports. And I think that in the most recent years, I was working with a company that served rural areas here in Arizona. I was actually going to outlying areas about once a month and seeing families doing home visits and seeing children in an office and working on their diagnostics and see what they needed. I have felt that's been so important because going into the home, number one, you're meeting the child and the family where they're at. And number two, you can really get an idea of what do they have going for them that we can take advantage of. I had a little boy who was just 2. Mom was homeschooling her older kids, and her big concern was that he was slamming into her all the time. I went in, I sat down on the floor, which I usually would do, and I started watching him. And what happened was he would run up to her and slam into her. And then he'd turn around and he'd run across the room and he'd slam into a piece of furniture. And he kept repeating that pattern. One of the things I learned over time is the critical need of sensory integration for children. And I said to mom, he's not being aggressive with you. He needs sensory input. So
Yes.
let's talk about some ways that he can get that without slamming into you and furniture and everything else. And then she was like, oh, so he's not being aggressive. And I said, no, he's not being aggressive. I had learned about that as a teacher because I worked with an occupational therapist who was very sensory integration oriented and knew a fair amount about sensory integration, which, of course, when you look at the neurotypical kids, is huge. Something that I feel like gets way overlooked a lot of the time and isn't looked at closely enough. That's definitely part of the picture. So, anyway, my role has been primarily in early diagnosis of autism. And over time, we've gone from when I first started doing it, we can diagnose them maybe around between 2 and 3. And of course, now we do it as early as 18 months and sometimes
Wow,
even
I didn't know that.
earlier,
Okay.
depending on what's going on. And based on research, that's helping us understand the patterns and being able to take a closer look at the dynamics of what's going on
Right.
with a child.
Right.
I think a great example of a shift in the field has been the diagnosis of girls. And the other thing is the amount of language. And there are assumptions out there that the kid can talk, they can't possibly be on the spectrum. Well, to
True.
what they're saying.
Mhm.
And the ADOS, which is considered the gold standard for diagnosis of autism, is huge on that. I mean, you're putting kids in a situation to try to get them to elicit what they're interested in, to get them to respond socially and that kind of thing. And there are kids who are just so tied to one thing. They could tell you every type of dinosaur there is in the world.
So I'm really curious because I'm a cancer survivor too. So I want to go back to something you said earlier in the conversation. Did you notice a change in yourself after recovering from those bouts of cancer? Was your spirituality different?
It's interesting because first, when I was diagnosed, I was in the process of having my deep brain stimulator put in, and it was breast cancer. And I was more worried about having a severe episode of depression than I was about getting treatment for cancer. And that stayed that way for me as I encountered other things along the way because the depression had been so incredibly pervasive. That was where it was at. That's another thing when you look at like the trajectory of mental illness is what are other contributing factors? What else is going on? The tendency, I think, of many people, including therapists, to not attend to what's happening in the spiritual realm per person. I was incredibly grateful to my oncologist. When I was diagnosed with breast cancer for the second time, we were talking about treatments, and I did not do well with the aromatase inhibitors, which they want you to take for extended periods of time. I had not tolerated them well the first time, and we were down to like 2 more to try. And the side effects were just horrible. And he said, well, let's try one more. And I went to fill the prescription, and the pharmacist said, that's contraindicated with your antidepressant. And the oncologist was amazing. Now, part of it is he had known me over a long period of time because I had gone through chemo the first time, just a lump. The second time around, I was like, I'm done. Turned out I had tumors in both breasts, and they were different kinds of cancer. And it was like, okay, I'm done. Double mastectomy, I'm done. And we had this conversation. And the gist of the conversation is if we talk about quality of life versus length of life, he said, your quality life is way more important. And the numbers, as far as whether you're likely to have further recurrence, are low enough that I personally think it's probably more important for you to stay on your antidepressant than to go on the aromatase inhibitor.
I have really enjoyed this conversation. Can you tell us a little bit about how we can find you on social media or where we can buy your book?
My book is available on Amazon in Kindle and print, and also through Ingram, which also distributes. You can buy from them online as well. If you join my mailing list, you get a copy of a free chapter out of the book. Then the blog is a weekly post, as well as having a weekly newsletter.
Well, thank you so much for coming today. I've really enjoyed our talk. Is there anything that you want our listeners to know before we head out today?
I just think you are ultimately in the driver's seat when it comes to your care, regardless of whether we're talking about medical, psychiatric, physical, whatever. I found I have to be my own advocate, and
Yes.
that I can take in ideas from all around me and from different resources, but ultimately, I'm the one that makes the choices with advice and input,
Yeah.
certainly from those that I trust.
Well, wonderful. Thank you so much for coming on. This is Dr. Cindy again, and we appreciate your time. I hope you have a great day.
Thank you very much, Amy.
All right. Bye bye.
Bye.
That wraps up another episode of Advancing with Amy, Mental Health Warrior. Thank you so much for joining us today and for being a part of our mindful community. I hope you found this episode insightful, thought provoking, and re energizing. Remember, your mental health is a journey, and each step you take towards self care and self awareness is significant. If you found value in today's episode, I encourage you to subscribe to our podcast so you never miss an episode. And if you feel inspired, please leave us a review and share the podcast with others. We value your feedback and are dedicated to creating content that resonates with you. Always remember that you're not alone in your struggles. Reach out to your support network, seek professional help if needed, and practice self-compassion. Remember to prioritize your mental well-being, honor your emotions, and take small steps each day toward your healing and growth. Thank you for choosing Advancing with Amy, Mental Health Warrior, as your companions on this empowering journey. We'll be back next week with another episode filled with valuable insights and uplifting stories. Until then, take care of yourself and stay mindful because you are worthy of a life filled with joy, peace, and fulfillment. Bye now.